Hello, I'm Timara Padgett, and welcome to this presentation of PTSD Coach, an app for the treatment of PTSD. PTSD stands for post-traumatic stress disorder. This has a frequency of up to 8% in the civilian population and up to 30% in the veteran population. The symptoms of PTSD include recurrent unwanted distressing memories of the traumatic event, including nightmares and physical distress when something reminds the person of the event. People with PTSD can have difficulty maintaining close relationships, feeling detached from family and friends, and they can feel always on guard, like something always is about to happen that is bad. Unfortunately, when PTSD symptoms become severe, the person might start having self-destructive behavior, such as drinking too much, driving too fast, or self-harm or suicide behavior. And people that have suffered PTSD in a group setting where maybe someone else did not survive, the survivors can have this overwhelming sense of guilt and shame as well. Obviously, these symptoms can be very life-affecting and life-altering, not just for the patient, but also for their family members, significant others, and close friends and families. The burden of care, however, is large. Treatment can at times be difficult for those with the disorder to obtain due to financial constraints, availability of providers, and distance to treatment facilities. You know that all healthcare workers, there's a shortage of all healthcare workers nationwide, but especially mental health care providers. So those that live in rural areas and maybe those that financially don't have insurance that can cover treatment or can't afford to take the time off of work have extreme burden or extreme inability to access care. There is also still, unfortunately, a mental health stigma in America where the client might feel ashamed or embarrassed and therefore not seek treatment because of those feelings. The PTSD Coach app was developed by the United States Department of Veterans Affairs, commonly known as the VA. This was developed for veterans, but was quickly adapted for civilian use as well. It actually had such promising results that other countries have adapted the app for use in their country. And to do so, they changed the language and adapted some features to be more customary to the location where it was being used. How the app works. Once the app is downloaded, this is the section that you would see. There are 4 different sections. In the first section, Learn, the app aims to teach users about symptoms of PTSD and the effects on the individual and their family and friends. There's also information on treatment options such as prolonged exposure therapy and cognitive-based therapy, which are the 2 most prominently used types of professional therapy for PTSD. The Track Progress section allows users to track their symptoms and track their progress by indicating current PTSD-related symptoms. The user would take a self-assessment of their symptom, and when they're having PTSD symptoms, there's I think a Likert scale that's about 10 questions, and it says how severe their symptoms are. When the patients are then able to go back in and see the interventions that they might have used and how those worked and see their progress over time. They can also share this progress or share this data with their healthcare providers who can review the data with the clients and reinforce their behaviors and interventions, which hopefully might help them be more apt to use the interventions that work in the future. Within the third section, Manage Symptoms, users can again enter their current subjective PTSD-related symptoms on a range of 1 to 10, and then interventions will be prompted based on the symptom type and the symptom severity. So in this manage symptoms section, the user might say like feeling anxious or having difficulty breathing, whatever their PTSD symptom is, and then they'll rate it on that scale of 1 to 10, and then an intervention will pop up, like feeling anxious. Maybe deep breathing would come up, or if they were indeed maybe developing towards a panic attack where they feel like they can't breathe, the intervention might be to call a support person or to dial 911. There are over 23 different interventions listed depending on the country that the client is in. But then the user can go back in and rate whether that intervention was helpful or not at the time. And it is a smart app, so it will adapt to the interventions that the user has said works well, especially based on the symptom. They can pair the intervention and the symptom together based on user feedback. The last section, Get Support. It's designed to provide crisis resource, including suicide prevention, hot or warm lines, assist in finding professional care, and information and tips to help grow the user's support network. Users can add a support person's contact information here as well. Within these areas, there's ideas listed on how to reach out and connect with others, including finding support groups. Patient impact. The primary goal is, of course, to prevent suicide. However, additionally, the reducing symptoms has a major impact on the patient and their families. Evidence-based treatments have been shown to be extremely effective, but we've already said they're sometimes hard to obtain for many different reasons. So this is a free app that can help clients that are unable to access those professional resources. It's actually a resource that those seeking and receiving professional care can obtain as well. Obviously, professional care providers are not usually available 24/7 on demand. So this is a way that when someone with PTSD is having symptoms, they can immediately access help. This is also a good way to be a good intervention to use while a client is waiting to receive treatment. Maybe a primary care provider has recognized PTSD symptoms or suspect PTSD, and they have put in a referral for treatment. It takes a while sometimes for the referral to be processed, a provider to be found, and initial treatment to begin. So this is an app that can be used and actually has been studied with promising results in that period of time before provider help can be established. So while it's not intended to be used alone, it absolutely can, though it does work best in conjunction with professional treatment. What the literature says, as I mentioned before, the results are overwhelmingly positive. When clients use the app, there's a decrease in symptoms, increase in coping skills, and a shorter treatment time. There have been, though, some negative effects that were reported. Most of them have been frustration while using the app, and most of these have been reported in those of older generations that maybe aren't as technology savvy as the younger generations. It's that is the main negative result that the literature has found, and it is not, again, not reported as often in younger generations. However, there is not a robust amount of literature on the PTSD app. Obviously, finding double-blind, randomly controlled trials is impossible as it's an app. The user would, of course, know if they were using it or not. However, there have been a few randomized controlled trials where the researcher was blinded, and those also had promising results. Additionally, most of the studies have had small sample sizes with all of the stigma and very personal information that goes along with having a mental health disorder. Sample sizes have been hard to obtain. It's been hard to obtain a large sample size for most of the researchers. However, the body of literature is growing every day. Two more Research articles were just published in the last few months, and the body of evidence continues to be strong. So the prevalence to the DNP practice, there's a lot. All practitioners and providers can interact with patients with PTSD, mental health care providers, family medicine providers, pediatrics. This disease impacts people of all ages, races, nationalities, and genders. DNPs should actively encourage patients with PTSD, those they suspect of having PTSD, and their families to download the app. Unfortunately, about 28% of healthcare workers can suffer from PTSD at some point as well. ER trauma care teams, as well as those working in mental health care settings, are at high risk, but so are all healthcare workers who might suffer from patient attacks or witnessing traumatic events. A relationship has been found between PTSD and a healthcare worker providing poor quality of care. It's been reported that PTSD can lead healthcare workers to experience compassion fatigue, reduced productivity, burnout, and an overall lower quality of care being provided. As Christians, DNPs, we are called by God to be the example, and therefore we should treat ourselves the way we should treat our patients. And the DNP's essentials call us to support the use of technology to care for those in need, as well as for caring for ourselves. I hope you have enjoyed this presentation. You'll think about using it in your practice. And if the time comes, hopefully it doesn't, but if it does come, you can use it or recommend it for yourself and those that you know. Thank you.